This is a CT angiogram of lower part of abdominal aorta and both lower limbs. Bilateral aortofemoral bypass surgery was carried out a couple of months ago. Now, let us evaluate first the abdominal aorta. Partly calcified atheromatous plaques are noted along the walls of abdominal aorta. Mild luminal narrowings are noted. Now, this is the site of the surgery and the anastomosis of bypass graft. Now, first let us evaluate the right side. Now, this is the graft which is completely thrombosed. This is right common femoral artery. This one is the external iliac artery. Now, this is the graft which is completely thrombosed. Low down, this is the inferior epigastric artery. This is superficial circumflex iliac artery. Now, both of these join the occluded external iliac artery. Now, this is the femoral artery, which is patent although its lumen is significantly narrowed. This is the graft here, which is completely thrombosed. Now, I trace it down. This is the profunda femoris artery. Its branches, it's fairly capacious, well outlined. This is the superficial femoral artery. Its lumen is quite narrow. Please observe its lumen. It descends down into the adductor canal and is completely thrombosed at this level. Low down, it is being perfused from the collaterals and its lumen becomes patent here. This is the popliteal artery. Its lumen is patent. Please trace it down. Now, this is the anterior tibial artery. Its proximal part is patent. This is the tibioperoneal trunk here. And low down are the. Now, anterior tibial artery is completely thrombosed, as is the dorsalis pedis artery. Now, this is the posterior tibial artery. Its lumen is narrowed. This is peroneal artery, this one here. I'll quickly trace it down. This is posterior tibial artery, just below the medial malleolus. Now, this is its lateral branch in the plantar surface of the foot. It's faintly opacified, but its distal branches are not opacified. Its medial branch is completely thrombosed. Now, I go back and retrace the left side of the graft and the left femoral and iliac vessels. Now, this is the graft, it is patent. This is the left common iliac artery, which is completely thrombosed. Please follow it down. Calcified atheromatous plaques. This is the graft, quite capacious, well outlined. Now, this is the left external iliac artery, it is patent here. I scroll it down. This is profunda femoris artery, fairly capacious, its branches. This again is the superficial femoral artery. Its lumen is significantly narrowed as compared to the profunda femoris artery. Superficial femoral artery in the adductor canal. At places, for example, at this level, its lumen is almost completely obliterated. But low down again, it is being reperfused from the collaterals. Popliteal artery. Now, this is the anterior tibial artery. It is patent. Posterior tibial artery, peroneal artery. Now, please compare these with the right side as well. This is anterior tibial. On right side, there is no anterior tibial here. The anterior tibial artery is traceable. Please follow. This is the thin anterior tibial artery. Blood flow is visible in the dorsalis pedis artery, this one here, but not in its distal branches. Same is the case with the posterior tibial artery. This is posterior tibial artery here. This one, its lateral plantar branch is patent. Some of the distal branches are also opacified like this one, but its medial branch is completely thrombosed. Now this is the 3D. One must evaluate 3D very carefully because on right side this seems to be a patent lumen, although this was thrombosed from the normal CT scan which I have shown you earlier. Now this is the graft here. This one is the site of the occluded left common iliac artery. One must do the reporting from the CT angiogram and not the 3D images because these may be misleading. The partly calcified erythematous plaques, these may give the false impression of the patent lumen, like these one here or these one here. On left side, almost all the arteries, 3 of them, they are well opacified, while on right side, the posterior tibial artery, peroneal artery are opacified, while anterior tibial artery is not opacified, being thrombosed.